Hello, everyone, and welcome back to Health News. More than 36 million Americans suffer from migraines, while more than 11 million blame migraines for causing moderate to severe disability. But now there's hope, a breakthrough medication that shows great promise in preventing migraines or making them less severe. Marty Salt now has the details.
71-year-old Karen Muzzy has suffered severe migraines for 50 years. She takes a wide assortment of daily and rescue medications to deal with them.
I take a beta blocker, I take 2 seizure drugs, and I take an antidepressant.
When migraines are especially bad, she can inject herself with a muscle relaxer, some Benadryl, or take a steroid plus nausea medication. The medications make her feel drowsy. She hopes to replace most of these drugs with just one, administered once a month in a pen-like device.
Someday this will be my single medication as opposed to having to have all these on hand.
This drug, Aimovig, and 2 others recently approved by the FDA are called CGRP monoclonal antibodies. They block the pathology that causes migraines. It's helping to reduce Karen's severe migraines from 16 to 4 per month.
We have not had a migraine-specific drug in several years, so definitely this is like the most exciting phase in the headache world right now.
Dr. Chowdhury has been treating Karen for years, even getting her to keep a headache diary.
I remember your pages being filled in, 3 or 4, and this looks great.
For Karen and her husband, life has changed dramatically, for the better. She doesn't feel the side effects of so many drugs.
I think she's enjoying life a lot more.
I'm Marty Salt reporting.
Now, the only challenge for patients may be the cost. One monthly dose costs $575. An appeal to Medicare cut the price for Karen in half. She and her husband say the relief is worth the high price. Senator John McCain recently died after fighting glioblastoma, the most aggressive and deadliest kind of brain tumor. Now, other patients whose brain tumors come back have a revolutionary new option for the treatment. Marty Salt reports.
That's not the last one.
Sorry.
Leslie Casillas recently found out her glioblastoma is back. She doesn't have symptoms and feels good.
Sometimes, I'm in the shower, I'll think, oh, I have a brain tumor, I have cancer, and it'll kind of hit me for a second, and then I just kind of go about my day.
She's waiting to see if she gets into a phase 0 trial at the new Ivy Brain Tumor Center in Phoenix.
This will be the tissue that we test for the clinical trial.
Dr. Nader Sanai says phase 0 trials shorten testing of new drug therapies from years to months, since the drugs are already approved for other conditions. Doctors give patients small amounts of drug combinations they believe are a good genetic match for the tumor. Then surgeons remove new growth.
In doing so, we can then take the tumor that we remove in the operation, test it, and answer 2 basic questions. Did the drug get there? And did the drug do what it's supposed to do?
Doctors know if there's a drug response within 7 to 10 days.
If they're on the study and they actually graduate to the therapeutic dosing after surgery, they're really doing so knowing that there's some hard evidence connecting their tumor's response to the drug.
That was exciting to me, to have the chance to take something that I know might actually work and have the proof that it's working.
I'm Marty Salt reporting.
Now, Dr. Sanai says 3 trials for about 50 patients are complete. In 2 of them, doctors identified drugs that had an effect and will be studied further. The 3rd didn't work, but he says researchers still got good information by understanding how it failed. New trials are open, and you can get more information at ivybraintumorcenter.org. Well, screen use can have a significant impact on brain development in young children. A new study looked at 3 to 5-year-olds who use TVs, tablets, and smartphones for more than an hour a day. Researchers said those children had lower levels of development in the brain's white matter. That's an area key to the development of language, literacy, and cognitive skills. The new study used a special type of MRI. It is the first study to document screen time and brain structure development in preschool-age kids. The study was published recently in the journal JAMA Pediatrics. Thanks for watching, folks. More NewsNet is around the corner.